Hello, good afternoon. Thank you for joining us for session 6 of our cybersecurity series. We'll be getting started in just a couple minutes. Thank you. Hello, good afternoon. Thank you for joining us for the session number 6 for our cybersecurity series. We'll be getting started in just a couple more minutes. Thank you. Hello, welcome to session number 6 for our cybersecurity series. We'll be getting started in just a couple more minutes. Thank you. Good afternoon. Welcome. Thank you for joining us today for cybersecurity session number 6 within our series. We are going to get started in just a couple more minutes. Thank you.
Hello, everyone, and welcome to our session 6 of our cybersecurity collaborative. We'll give everyone just another minute or two to get connected. It is the bottom of the hour and our start time, but we do want to give people just a couple more minutes to get connected in. Hello again, everyone. Maybe we'll give folks just another 30 seconds and then we'll get started with our program for today. All right. And with that, why don't we go ahead and get started? We've got a couple of introductory notes to make this morning before we get into the agenda. So again, welcome everyone. For those of you who have been able to participate in all of our sessions, this is session 6. It is the wrap up and our last of our first go around of this cybersecurity collaborative. Our objectives for today are to discuss how to interpret the SRA results. As you may remember, we went through each one of our sessions discussing how to do the SRA. We'll discuss a little bit more about best practices on reporting and reviewing of that SRA that we hopefully have all had an opportunity to complete. We'll talk a little bit about how to maintain your new strong security practices and continue to improve those. And the importance of doing that SRA every year. And then also we'll start off with sharing again why cybersecurity is important to Health Choice Network and to Alliance Chicago. So next slide. Once again, I'm Matt Sterling from Alliance Chicago. With me, you'll hear later, Michael Sangili. We've been your moderators for this whole session. And hopefully we've been able to help share some good information. We are both available by email at our security team at alliancechicago.org or Michael at security team at hcnetwork.org. Keep in mind that we are here and available to provide support. There'll be some more discussion at the tail end of this session about that as well. So next slide. So the agenda for today, we're in the welcome and introduction right now. We want to talk a little bit about the importance of cybersecurity education, the importance of executive leadership engagement, and hopefully there are a number of executive leaders on the call here. We were hoping that folks would participate in the first and then again here in the last, so that we can tie it all together. There'll be a recap of reporting and a recap of our sessions 2 through 5, and then we'll complete with some next steps. And as always, feel free to ask questions. So next slide. Again, back to logistics. Everyone will be muted for this meeting. So please, if you do have any questions, put them in the chat. If you have any problems with that, I think there was a session earlier on. But please go ahead and type in any questions that you might have for the entire group, and we'll cover those at the tail end of the meeting if there are any of those. This session is being recorded, so there will be opportunity for you to go back again and listen to things, so you don't have to take notes. We'll make the slides available. And then lastly, thank you again for joining us in this journey in our 6 sessions, and again today. And we're excited to get things started. So with that, I will hand off to Alex Romeo. Alex, take it away.
Good afternoon, Matt, and good morning, everyone. Thank you for joining us again as we close out our 6-part series on cybersecurity and safety. I always like to add that patient safety and confidence issue as we talk about cybersecurity because we're implementing systems, technology, and resources and promising practices not only to keep our individual organizations safe and secure, but also instill confidence for our patients as we look to exchange more data than ever before from various locations and resources as this pandemic has required us to do so. I'm Alejandro Romeo. I serve as the president and CEO of Health Choice Network. I've had the distinct pleasure of working along health centers now for about 22 years and along the Alliance Chicago for the entire part of my career here at Health Choice Network. It's truly been a pleasure. As we've engaged and embarked on these webinar series, our goal is very simple, is to share information and make sure that our health centers are educated to make good decisions based on data and provide subject matter expertise in all these various areas. Next slide. So I know many of you have heard this quote before from the Bureau of Primary Healthcare that no one should go about this alone. We've taken that to heart. So the Alliance Chicago and HCN have continually sought to partner and find ways to serve the greater good by using not only our network resources, our expertise, but also grant funding to include our PTech and QTech grants that are funded by HRSA to make sure that we promote and educate our health centers, not just the members of HCN and Alliance Chicago, but all the FQHCs at large. Because we do believe that we are stronger together. And when it comes to cybersecurity, as we talk about this topic, it is critically important that we recognize how much money has to be spent, not only on expertise and resources, but the fact that there is a competitive nature out there to be able to hire and maintain resources that have the expertise in cybersecurity, but also the technology and the equipment that we need to keep our health centers and our patients safe. Next slide. So back in 2019, our board of directors at Health Choice Network, along with the partnership with Alliance Chicago, decided that we had to invest in technology, and specifically in cybersecurity. So we created our cybersecurity, the CISO team, the Chief Information Security Office team at the Alliance and HCN to make sure that we can deal with threats and support our health centers. At that time, back in 2019, our health care systems, so the hospital systems, the insurance systems had already invested millions of dollars in cybersecurity because they were the threat. They were actually were a target for cyber criminals and data breaches. And then we started seeing a growing increase of those cyber attacks on health centers. And so we wanted to respond very quickly. Now, with the limited resources we have across all the networks that serve health centers, we wanted to make sure that we were doing this in a marketplace environment where we can share expertise, we can target that expertise to the marketplace that we serve, and more importantly, customize it to health centers. Many of the tactics and best practices or promising practices used by the insurance industry and hospital systems are known to us. But what they don't know is the amount of data that we handle from various sources, because we truly are, as the ambulatory PCP and the true medical home, the glue of all this information. So health centers are receiving information from all over, including these hospital systems and healthcare systems, in addition to having their own data and security needs. So we're excited about not only embarking on all these various opportunities to collaborate, such as research, our data infrastructure, our clinical leadership and practice transformation, technical assistance and education, and learning collaboratives. And you're part of one of the learning collaboratives here as a 6-part series on cybersecurity and safety. Next slide. So as we look at the growing trends in regards to the compromised patient records, it is a well-known fact that all of us have had some type of data breach. We may not know about it, but we all have been a victim of this cybersecurity threat and crime. And as you can see the numbers in 2020, specifically when the pandemic was going on, we saw more and more offices and workplaces send their associates and their staff home. We saw our healthcare providers start seeing patients from telehealth locations that were not expected, such as their home. In some cases, we've actually seen providers in their car try to serve the patients that we serve via an iPad or an Android device. And so we had to rack up all the technology that we had been planning for the last 2 years and make sure it was ready for the challenge. We had, at a Health Choice Network, we had about 9,800 users go remote. So it wasn't a matter of having 9,800 users out there in physical locations that we knew about. This was people's homes, people's workplace, remote locations, vacation spots, and anywhere they felt safe as they social distance and tried to weather the storm. So you can see the amount of records, and you can see the data breaches in 2020 continuing to grow, reaching 9.7 million, which I'm sure our cybersecurity team can give you more information on why that peak there. But for those of us that are not in the cybersecurity environment, but we know how important it is as an executive of a healthcare organization, we realize these numbers are staggering. And as you look at the holiday season, is always a tough season. People become a little relaxed in their login and their passwords and sharing information. But obviously the 2020 pandemic required us to go remote. And this also caused and was a factor in some of these record data breaches for 2020. Next slide. So we now have a cybersecurity and infrastructure security agency up in DC, and this is data directly from their website this morning. I actually pulled it this morning. So the cost of cyber crime in 2021 is estimated to reach $6 trillion. And if you look back in 2015, $3 trillion was high enough, but the fact that they're expecting that number to triple this year is staggering. So even though we're putting systems in place, policy and procedures in place, technology, education, and resources in place, we realize, and they realize, that this is a major threat on the economy, a major threat on our business, and our major threat on all lines, including product lines and support lines. And if you go on that website, which I actually go on often on the Cybersecurity Infrastructure Security Agency, you can see the threat levels. Right now, there's a huge threat levels to the pipelines, to the oil pipelines, once again. And so it's very interesting to see how these cyber criminals are using the marketplace and also our economy to attack willingly. 32% of healthcare organizations experience some type of ransomware in the past few months. And that's important because we've actually been reached out by many health centers that either have had ransomware or phishing attacks, and they've had to not only pay up, they also didn't realize that they were a target. So hopefully now after the 6-part series, you realize that you not only are a target, but that we can actually put things in place to prevent you from being a victim. And then the other fact that I pulled down from the website is 8 in every 10 healthcare organizations regularly report on stat of the cybersecurity to executive management. So this is interesting for us because I've been involved in 4 different cyber crime recoveries for health centers specifically. And unfortunately, the executive team and the board of directors were the last to hear about it. Because the IT teams and the staffing that were involved or made a mistake were trying to figure out ways to keep it under wraps and try to limit their exposure, specifically because of our patients. We want to make sure our patients are always safe and secure and their data is never compromised. It's never done with malicious intent, at least in my experience. It's always been done with we just don't know what's going on and we need more help and more information. But during that time, we lose valuable time to be able to recover and safeguard our information and deal with the threat as it's required. Next slide. So our cyber team here put these facts together. You can see the causes of 2020 healthcare data breaches there on loss, improper disposal, theft, unauthorized access, and hacking. Obviously, the IT incident, someone actually trying to access information that they're not supposed to. And then you can see the location of these breached healthcare data. You can see where the laptop is on the bottom, and you can see where the email network servers are at the bottom of the list, but the highest. So what does this tell me from a previous CIO perspective is that the cyber criminals are targeting where the data is being stored. In the old days, we had a lot more attacks on the local workstations, the laptops, the portable devices, and the desktops. Those devices through the years with their operating systems have become more secure. And we also have a lot of more provisions around those devices, such as antivirus, anti-phishing, and anti-theft software and technology, specifically with us implementing dual authentication. And so the user themselves, even though they're the highest point of entry, their devices are more secure today. The cyber criminals want to target their biggest bang for their buck. So they're going after those servers where the data is stored and the applications are delivered, and obviously where email is our new way of communicating, our official communication route. So obviously phishing expeditions on executives, providers, and caregivers during this pandemic were at the highest point we've seen. On the other side, on the cause of healthcare data breaches, you can see that the hacking IT incident there is 429 of those breaches were hacking IT incidents. That's disturbing from us, just because in the past we saw that, yes, we saw unauthorized access at the highest point, people sharing their passwords, not using secure passwords, accessing general workstations out in the community, accessing Wi-Fi spots that they shouldn't, which I'm sure all our security professionals have already told you not to do that. But when we look at the hacking IT incidents, that means that they are taking a deliberate target on the healthcare marketplace because of the pandemic, and our health centers are in the midst of that. So we're monitoring this information because that means we have to change our approaches, our technology, our resources, and our investments in security. Next slide. So with that, I'm going to leave you there, and I'm going to pass it on to my dear friend and the president and CEO of the Alliance Chicago, Dr. Fred Brockman, to take us as far as why the executive leadership engagement is so important during this cybersecurity. So Fred, good to see you.
Great. Thank you, Alex. So as Matt said, we're really hoping that some of you from the general C-suite or executive team at the health centers were able to rejoin us for this last in the series today. And we think it's essential that executive team, non-IT executives need to be very involved and knowledgeable in this area because of the magnitude of the risk. Your teams have done awesome work throughout this collaborative, and now need you to really fully understand and appreciate the importance for you to support the strategies, tactics, and resource investments that they're counting on you to make. That's one reason. And the second reason, could you go to the next slide, please? Because underneath all of this work, we understand that the true risks of privacy and security are at a very, very individual and human level. At the heart of any, back to the previous slide, please. At the heart of any privacy and security program, really, we're constantly balancing measures to protect privacy and security against expediency and availability of information. And this is probably what you really experience on a daily basis in areas like how we manage passwords or screen or timeouts or access to devices. because on the one side, clinicians and users are screaming for easier access, and certainly that's gotten even broader in the current environment where we're delivering care in new settings, against some of the measures that we put in place to control them. So there is, in addition to that role that you play in allocating resources, is also the role that you play in terms of assuring that we're striking this right balance and that you're providing the right leadership to the entire staff. Next slide, please. So I just wanted to briefly recap again these classic roles of leadership in any sort of change management or new initiative in an organization. The four main roles are the sponsor, the change agent, the target, and the advocate. So the target is all of us actually in an organization. We are people that are called upon to implement procedures or carry out policies or strategies. But we've also designated the folks that have worked so hard throughout this collaborative, we've asked to be change agents. We've asked them to be responsible for laying out the plan and the groundwork for continuously monitoring and addressing privacy and security needs. And then there's the role of leadership. We are the sponsors. We are the ones that have the organizational power to stand behind any of these plans and to allocate resources and to make sure that these changes can in fact be implemented. The last role is an advocate. That's someone who wants to see these changes take place, but really has no authority within the organization. So on this call, Alex and I, in a way, are advocates, right? Because we don't have any real authority within your organization. But what we want to make sure is your teams that have worked so hard over these last few sessions to develop these concrete plans to improve things at your health centers have the adequate sponsorship from you as leaders, because otherwise, without that, they become nothing more than advocates. They're really not going to be able to be empowered to do any of these changes. So the next slide, just as a last reminder for you, next slide, please. The role that we play as executive leaders are, first of all, to understand the reasons for an organizational impact. And so that's why we're going to be going through today all of the work that was done so that you truly are positioned to understand what needs to be done. And then very publicly, we're hoping that you will play that very, very important role and face within your organization of standing behind our teams in terms of implementing all of these measures. In order to do that, you need to be fully aware, again, as you listen today, about the scope and what the impact will be within your organization, and know what the resources are. And you'll have some hints today, but also go back and make sure you work with your teams to understand what they will need in order to move forward. We also hope that you will be part of ongoing monitoring actions. These should not be delegated only to the IT team. This is something that the entire executive team should be looking at, given the magnitude of the threat that Alex outlined, and be able and willing to manage any resistance that you see within the organization. And finally, this is not a one-time exercise, it's an ongoing exercise. So my last remarks are for those of you on the call that are not in a leadership position. Again, we don't want you to wind up, if your C-suite is not on this call, we don't want you to wind up as only advocates. We've made a big investment in helping you go through this work over the last 6 weeks. So in order for you to not be advocates, but to truly be able to play the role of change agent, I know Alex and I are there for you. We want to help work with you in whatever way we can to appropriately engage your leadership in understanding the importance of their role. So with that, let me turn it back over to Matt.
Thank you, Fred. So for those of you that are joining in at this latter part of these series, my name is Michael Sangili. I serve on the Chief Information Security Offices team at Health Choice Network. And throughout this whole webinar series, I've been working with Matt on educating everyone at the health centers on how to properly perform a security risk assessment across your organization and how to identify all these threats. So we want to give you a quick recap and report on everything we've gone through so far so that you can get an understanding of how deep we really dove in through all these sessions and everything we have learned and come to conclude. Next slide, please. So on our first real technical session, we began diving into the SRA tool. We formerly, in all the past years, we've used an Excel document, which was a bit clunky and a little hard to understand. Recently, the HHS has developed this SRA tool, which is an open source tool that you can just download directly from their website. And it's essentially an intuitive guide that brings you throughout the entire SRA process, section by section, step by step, and makes it very easy for you to understand and very easy for you to pull data and reports from this tool so that you can really understand where you are through this SRA process. So next slide. In the first portion of the SRA tool, we dug into the basics, SRA basics and security policies, where we covered general security risk assessment practices, such as identifying hazards, deciding what may be a hazard, what may be not a hazard, evaluating risk and deciding on precautions we should take towards them, how to record your findings and properly implement them. We also discussed HIPAA security regulations, specifically the HIPAA security rule, which we dove into several steps of the HIPAA security rules and things that we should be abiding by, such as this SRA. A lot of people didn't understand that this is an actual mandatory task as part of the HIPAA security rule that should be performed annually. So that's a big focus for us throughout these sessions. Another item we covered was key security policies. So we discussed security policies such as your acceptable use policy. So if you have new employees come on board, they should understand and sign something over that says that they will abide by the rules of your organization on how to use their devices, your internet, how to properly handle patient data and not expose patient data. And we also discussed everything all the way to security policies, such as EPHI encryption. On, if you're an IT team, how do you properly encrypt your EPHI? If EPHI is being transmitted or received, do you have the proper encryptions implemented in your organization to truly secure that patient data? Then finally, security policy management. We just discussed on how you should continuously update this. This isn't something that you set and forget, because networks and organizations are continuously changing. So if you're moving from an on-prem server to a cloud-based server, more than likely your encryption and your security rules are going to change. So your security policies should be updated with these changes as well. Next slide, please. So on session 4, we discussed security and the workforce. Here we discussed identifying your key personnel, your key SRA personnel in your organization, because a lot of people think this is just an IT team type of task, when in reality, this encompasses almost all your leaders in your organization, as this covers various areas through your organization. So you will have everyone from a medical director involved to your IT team, to your security guys, to even your physical security staff will have to have a footing in this SRA. So it's important to identify your key SRA personnel, and this is where we outlined who should be identified. We also talked in here about your incident response team, where you create your incident response team, which is mainly formulated from your SRA team. And this team is used to identify or do tabletop exercises of a simulated threat in your organization and how you would react to that threat. So some of you in this call actually went as far as creating your incident response team, and I was honored to be reached out to sit down with your team and watch you all go through your processes and create these dummy scenarios of, let's say, a virus entered to your organization, or even a power outage entered into your organization, and you each went through your whole entire team and discussed what you would do step by step. Now, what that does is properly prepares you for these situations, which is an amazing precaution to be taking in case anything like this happens. So we also discussed security awareness training and the importance of it, either conducting it on your own or contracting out a third party, but the importance of educating your staff on these security risk and items out there that people may not be aware of, because again, this is no longer just a security thing. This is all the way down to the basic user who has very minimal access to something but can still fall for a phishing attack. So again, it's always important to identify every part of security risk and relay this information all the way to your users. And lastly, in that section, we discussed ePHI access management, how to properly have access control of your ePHI, who has control of this patient data, and educating everyone on how to properly handle this without improperly exposing patient data. Next slide, please. So in session 5, we discussed security in the practice, security in the BA, and contingency planning. We discussed ePHI CIA, which is confidentiality, integrity, and availability. This is essentially the way to keep your ePHI confidential, keep the integrity of your ePHI, and keep your ePHI available to its users and its patients. We discussed reducing risk through BAAs, so managing your business associates. Many of us in our different organizations, we are continuously contracting out third-party companies. So we learned how to reduce risk through implementing BAAs and making sure these business associates are properly managed as they perform their tasks within our networks. We also discussed contingency planning. We did everything from data backup plans. We discussed your disaster recovery plans and your testing and your revision procedures. I know some of you asked me for some templates of contingency plans, such as your data backup plans. We went over through some of these documents that kind of gives you an idea of how to formulate your own. But again, every organization is different. Your risk level is different. And so your data backup plans, your disaster recovery plans should all be different. Next slide, please. And this final session, we're just going to quickly discuss our reporting and how to finally wrap it up and how to interpret your results. And we just discussed how important it is to have sponsorship and individuals behind us to help us complete these SRAs, because again, we all went through them and we realized how in depth these SRAs really go. I mean, these SRAs aren't something you complete in 1 month. This is usually a very long process that requires sometimes new technology and funding to implement the proper security and controls in our organizations to protect ePHI. So we discussed all these things and the importance of having proper backing behind us as we complete our SRAs. So next slide. So we'll go over quickly the SRA reporting. We covered this briefly a little bit, but this is going to be our last 2-slide technical portion of the SRA. And here you see this is our final outcome of our dummy health center, you can call it. And we used just a mock health center to run all these SRAs throughout our entire webinar series. And if you see, the final report breaks down section by section. You're able to see where your weakest sections are. So for those of us that have completed our entire SRA, you can see each section. It tells you where you're weak, where you have the most weakest points, and where you need to work on. You can see here on our dummy health center, our section 4 was very weak. I know we covered ePHI encryption very deeply on that section 4, and that's where our health center was the weakest on our example. So if you expand that section, you'll see it'll break it down further for you where your weak points are and where you need to work on. Remember, this can always be exported into a PDF. You could use this in a meeting, bring this out in an Excel sheet, and it'll break it down further for you, and you can review your risk score and how to tackle all your risks. So next slide. So this is the area where you actually see your levels of risk. One of the main parts, we've discussed this several times, but just to reiterate this, how to understand a risk rating. There's always, you have to understand the likelihood of a threat occurring versus the impact the threat would have. So just because you have a threat in your organization, let's say you have a server that is locked away, air-gapped, and not connected to the internet, and has a very dangerous vulnerability that can be exploited by just a hacker just taking 5 minutes of his time to press a few buttons and it exploits it. That sounds like a critical vulnerability, but because of the fact that it is hidden behind closed doors in a very airtight area that's locked behind many locks, that would bring that risk level much lower than critical. So sometimes we just quickly hear this vulnerability is labeled critical just because it's easy to hack or take advantage of, but that's not always the scenario. Again, we've discussed how it's different from organization to organization, depending how your networks are built or your organization is structured. So always just make sure you understand the likelihood of that threat actually occurring and the impact that threat would have on your organization to properly label it. So your risk report is going to include these vulnerabilities and your risk scores based off how you felt it would impact your organization. And this will allow you to tackle your vulnerabilities in a specific order. So you always want to start with your criticals first, of course, because that usually means some sort of imminent threat that anybody can take advantage of right away, then move down to your high vulnerabilities, then mediums, and then lows. Next slide, please. So something we want to highlight that we don't just want to look at this SRA as some sort of task we had to do because of a HIPAA guideline. Something you can take advantage of this SRA is that it is essentially a security roadmap. Over these 6 months and everything we have done over these 6 months together, all these reports we've put together, all this data we've gathered across our organization, all of the different leaders we've spoken to answer these questions across our organization, we essentially created a security roadmap. This is something phenomenal to have at your organization. It's amazing how many teams do not have some sort of security roadmap, but what you did is just created one. So now you're able to identify your security, your criticals, your mediums, your highs, your lows, and you're able to tackle them into a specific order. I strongly recommend taking this, sharing this out with your SRA staff or your IT team and showing them and continuously, maybe having a meeting monthly or quarterly to go over your SRA and see where your status is at. Get rid of those critical vulnerabilities, those highs, those mediums, those lows, and little by little, this will make your organization more and more secure. So don't think of this as just a security risk assessment. Think of this as your own personalized security roadmap. So not only did we identify all our critical vulnerabilities, but all these questions we've answered, we now know the technology that we need to implement into our organizations. We know the processes that can help us tackle vulnerabilities in our organizations, all the administrative tasks that we need to take advantage of. So again, take all that information, put it together, export it. You could even customize it yourself, share it with your team, and use this as your own personalized security roadmap that you just consistently review and update. And with that being said, I'm going to pass it over to Maylee Sanchez. She's going to talk about what's next. She's going to talk about your ongoing steps and how to just properly maintain everything yourself. I also want to say thank you, everybody, for these whole 6 months you've been with us. I know it's been a lot of work. I'm glad everybody got to put together this report, and I hope that you find it very useful. Thank you, everybody.
Thank you, Michael. As Michael mentioned, my name is Maylee Sanchez, and I have the honor of serving as Chief Information Officer for Health Choice Network, and I've been with the organization for 3 years. I'm very excited to be here and this wrap up and to have seen all the progress and all the work done over the last 6 months. So now, what do you do with that? What's next? Next slide, please. So what do you do with all the great work that you've done over the last several months in this webinar series? First and foremost, as Fred mentioned, engage and involve your executive sponsors. This is critical to the success of your PTech, QTech program and of your security strategy. Security risk assessments are required annually, and as Mike mentioned, it can be used as a roadmap or blueprint for your organization's security strategy. Finally, Alliance Chicago and Health Choice Network are always available to help answer any questions you may have. And with that, I want to thank you all for your participation and engagement over these last 6 sessions, and we look forward to working together again. Thank you, and I'll pass it off to Stephanie.
Thank you. Good afternoon. So we do not have any questions currently in the chat. So with that, I think we are good to close the session for today. Thank you everyone for taking the time to join us for session number 6. And we look forward to seeing you in the future sessions and opportunities with our networks. Have a great day. Thank you.